When it comes to relieving acid peptic disorders, you may think that you're condemned to a life of antacid use and dietary restrictions, but this isn't true. Since their introduction into the market, sufferers from gastroesophageal reflux disease have been able to effectively manage their disorders. But while very effective and favourable, their use does not go without concern. Today we'll be focusing on how these drugs work and the controversy surrounding their adverse effects and high costs associated with overprescribing. Proton pump inhibitors, or PPIs, are oral medicines that reduce the amount of stomach acid. They help to relieve the symptoms from acid reflux or gastroesophageal reflux disease, treat peptic or stomach ulcers, or treat any damage to the lower esophagus caused by acid reflux. Under normal circumstances, the stomach will produce acid for protection against germs and bacteria and for the proper digestion of food. This acid, however, is extremely erosive, and so a protective mucosal barrier is created to prevent the stomach lining from eroding away. When this mucosal protection breaks down, the exposed stomach lining can damage and can result in an ulcer. To keep the stomach sealed and prevent its contents from escaping back out, the esophageal sphincter sits at the top of the stomach, preventing this from happening. When this is defected and doesn't close properly, acid escapes, irritating and inflaming the esophagus. This is acid reflux. Stomach acid is produced from the stomach lining by parietal cells, and PPIs work by inhibiting the proton pump enzyme, the final step of acid secretion. When this is inhibited, the exchange between intracellular hydrogen ions and extracellular potassium ions is hindered. This means that the amount of hydrogen ions being released into the stomach is reduced, therefore decreasing stomach acid and relieving acid peptic disorder symptoms such as heartburn. The high effectiveness and low toxicity of PPIs has led them to be one of the world's most frequently prescribed drugs since their introduction in the early 90s. In Australia alone, PPIs have increased in use by over 1,000%, with a huge 19 million prescriptions in 2013 to 2014. Over the last 10 years, at least 2 PPIs have been included in the top 10 most prescribed medicines. But with any increased use comes an increased concern, particularly when that use is long-term with a questionable purpose. Reports have linked PPIs to potential consequences such as increased risk of fractures, enteric infections, pneumonia, vitamin deficiencies, and intestinal nephritis. As mentioned previously, PPIs lower the acidity of the stomach, and in response to this, there is an increased production of a hormone called gastrin, which stimulates acid secretion from the parietal cells. When gastrin levels increase with PPI use, rebound hypersecretion of gastric acid occurs, and ultimately hypergastrinemia. Studies have also found that meal-stimulated gastrin release during PPI therapy correlates with an increase in ECL mass, which is gastric acid-producing cells, which has been feared can lead to cancer. However, no evidence of this has been confirmed in human studies. There are also financial implications on both individuals and governments associated with overprescribing and overuse. Studies have found that reasons for prescription have been questionable. In Australia, 63% of inpatients taking PPIs did not meet the criteria needed for taking the drug, and in 2013 to 2014 alone, there was about 7 billion subsidised PBS subscriptions of a PPI, which cost over $200 million to the PBS. So while PPIs are highly advantageous and still a leading therapy for acid peptic disorder management, increased attention still does need to go into the concerns and adverse effects and the costs associated with their overprescription. But one of the most important questions that needs to be addressed is whether or not people using PPIs really need to be taking them. There are factors such as the need to relieve symptoms, indigestion, and the ease of access of PPIs that lead people to continue using them for long periods when other factors such as diet or lifestyle change can be just as effective. There is no doubt that PPIs have been a revolutionary therapy for numerous disorders. The overall benefits of therapy and an improvement in patient quality of life outweigh potential risks in most patients. However, PPIs and any other drug therapy, regardless of their safety margin, is not without risk, particularly when primarily intended for short-term use. The aim now should be to put numerous measures into place to educate clinicians on the appropriateness of long-term prescription and reassess patients' need for PPI therapy.